Concerns are growing about a so-called triple-demic heading into the holidays. At least 45 states plus Washington, D.C. and Puerto Rico are now reporting very high or high levels of flu activity. This as the spread of COVID is increasing in California and the Northeast, and RSV is still a concern. Let's bring in ABC News medical contributor and epidemiologist Dr. Brownstein for more on this. So, Doctor, LA County hospital beds are now at their lowest availability since the pandemic began. COVID deaths there have surpassed the count from last year at this time. It will be 3 years this March. Hard to believe since the pandemic began. So in some ways, are we going backwards, do you think?
Well, Alexis, we aren't going backwards, but this virus is still with us. Cases are going up across the country as expected because of the winter surge, but we have the tools, infrastructure, and know-how to combat this surge. It's about fatigue in the population, especially when it comes to boosters and doing what it takes to reduce transmission. We have to remember, we're in a much better place than we were years ago because we've delivered over 500 million vaccine doses. 80% of the population has one dose. We've averted millions of deaths and millions of hospitalizations. So we're in a much better place. At the same time, we know this virus isn't going anywhere. We're going to have these annual surges just like we do with flu. So we just have to think about COVID like the flu, getting that annual booster. That's probably what we're going to have to do in the future to make sure that we keep mortality and hospitalizations down.
And of course, to complicate things, a lot of Americans are finding out that COVID, RSV, and the flu all present similar symptoms. So how can we tell the difference, and how does that ultimately determine treatment?
Well, ultimately, these are respiratory viruses that all have about the same treatment. You want to make sure that you're hydrating and taking care of yourself at home, no matter what that respiratory virus is. There's so much overlap in the symptoms, so I want to be very careful about that self-diagnosis. It's really a challenge. The best gold standard is getting that test. We know that there's overlap and even overlap with a common cold. But, for instance, RSV is, a virus that affects are very young. It's that classic wheezing. With the flu, you get that high fever, the symptoms that come on really fast. With COVID, those symptoms have been changing over time, that loss of taste and smell that's less apparent now. But, we know that COVID can have broader impacts across your body. So there is differences, but ultimately the idea is that, you want to make sure that you're taking care of yourself at home, managing those symptoms, especially calling your physician or going to the emergency department if those symptoms escalate. And especially looking at our youngest kids, making sure that, any symptoms that get worse in terms of fast or labored breathing or that wheezing, you absolutely want to get checked out. But ultimately, we do want to make sure we're protecting our emergency departments this holiday season because they likely will be overwhelmed.
And Doctor, what is your advice to all of us as we start gathering with family and friends for the holidays? How can we stay healthy?
Yeah, well, Alexis, it's that pandemic playbook that we've been drawing from for the last 3 years. So, yes, we're still dealing with COVID, but we've learned a lot. And we know that we want to protect our most vulnerable. We want to mask as necessary. We want to test, for COVID as possible, before you gather. You want to make sure that if you have those symptoms, stay home. I know that's really challenging, but especially if you have vulnerable members of your household, you want to make sure that we're protecting them. So we know what needs to be done. We know that we need better ventilation in the home in order to reduce transmission. And we know that we should get those vaccines, that flu shot, which is a good match this year, and those COVID boosters that are plentiful and available. Top up that immunity before you start to gather. We, again, want to make sure that we're protecting our hospitals across these triple demics, but plus these other viruses that are circulating as we go deeper into the winter months.
Yeah, we know what to do, but always a good reminder. Dr. Brownstein, thanks so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.